As a cardiologist, too often I see patients after that disease have damaged the blood vessels in their heart and their body completely. In the next couple of minutes, I'm going to explain to you how to avoid that. Millions have the disease for years and don't even know it. They feel fine, no pain, no warning, but inside your body there is a war. High blood sugar is slowly destroying that body, your brain, your eyes, your heart, your kidneys, your genitals, your legs, and all your blood vessels. And by the time you have symptoms, the damage is done. That is diabetes for you, another potent and sometimes silent killer. Today, more than 800 million people worldwide live with diabetes, and about 500 million more have prediabetes, meaning the blood sugar is already rising. Worse, 80% of prediabetes, which is about 400 million people, and 25% of diabetes, about 200 million people, don't even know they have it. The danger is that diabetes does not only affect sugar levels, it matters because the disease affects the entire cardiovascular system. So what is diabetes? To understand diabetes, we need to understand insulin. Insulin is a hormone produced by the pancreas. The job is simple. It helps glucose move from the blood into the body cells. Our body then uses glucose for energy. But when insulin doesn't work properly, glucose remains in the bloodstream for a long time. Over time, high blood sugar begins damaging all the tissues and organs in your body. Now, what are the different types of diabetes? Nowadays, I would say there are 4 major types of diabetes. If you read all the textbooks, they're going to tell you about 3 major types. But I, as a cardiologist, I think we need to focus more on the number 1 start of diabetes that have a lot of people with no symptoms. That 80% of prediabetes with no symptoms. So I would say number 1, prediabetes, is when your fasting blood sugar is between 100 to 125 milligrams per deciliters, or your hemoglobin A1C is 5.7%, between 5.7% and 6.4%, and you have higher than normal blood sugar in your body, often seen in people with what we call metabolic syndrome. That's the number 1. And 80% of these patients don't even know they have that problem. And the damage started already years ago. Second is type 1 diabetes. It's an autoimmune condition where the body destroys insulin-producing cells, and often the patient requires lifelong insulin therapy. Third one is type 2 diabetes, the most common type. It occurs when the body develops insulin resistance. Cells no longer respond properly to insulin. And type 4 is gestational diabetes, where that develops during pregnancy and increases future risk of type 2 diabetes. What are the real causes of diabetes? Several factors increase diabetes risk. Number 1 is genetics. Your family story plays an important role. Second, excess abdominal fat. Belly fat is strongly linked to insulin resistance. Third, sedentary lifestyle. Muscles play a major role in using glucose. So the less muscle you have, the less glucose you use. So less movement leads to poor glucose control. So exercise is very important. Diet high in processed foods. High refined carbohydrate can worsen metabolic dysfunction. Sugary drinks, all those processed foods are bad, and they are the causes of diabetes, at least in part, especially prediabetes and type 2 diabetes. Click on the link above so you can watch part 2 of this video.